My name is Dr. Vikki G for George Hufnagel, MD. I've been asked to testify by DoIt.News as to the events that happened in 1995 when I asked for a hearing before the Medical Device Committee of the FDA in Maryland. This is 1995. I am making this testimony under penalty of perjury by the laws of the state of California where I reside, and also by federal law. All statements that I'm making in this recording are statements that I am making under penalty of perjury, and thus this is a legal document, and it is my belief it's the first audio legal testimony to be provided using media. So thank you, DoIt.News, for giving me this first-time opportunity. Background. I am a trained OB/GYN. My schooling included attending the University of California, Berkeley, where I was very active and helped create the first woman's free clinic in the nation. Wrote chapters for the books Our Bodies, Ourselves, and worked to be a member of the Berkeley Women's Health Collective at that time. I attended UC Davis, where I was recruited. Dr. Lindsay Kumagai recruited me to become a doctor because he felt that my work in women's medicine as a college student was exemplary. My mentor at the time was at Berkeley was Dr. Alan Steinbach. I then went on from UC Davis because I decided that I wanted to be a surgeon, and I went to UC San Francisco Medical Center in order to train to become a surgeon. My major areas of training were in neurological surgery and cardiac surgery. I had an event during my training there that I nearly died from a misdiagnosed disease in which my gallbladder was rupturing, and Dr. Larry, or known as Larry, but he's also known as Dr. Lawrence Way, saved my life. I continued as the only female in my class to go through what is called a surgical pathway. Women at that time were not encouraged to be surgeons. I finished the surgical pathway and met with Dr. Way, and he said that my skills were excellent, above average, and that I should think about, because of my background in women's health, becoming a gynecologist. He then went on to comment that gynecologists were not the best surgeons. They didn't have the best skills, and he felt it was the area that I could more than likely provide change to because of my training and natural skills that I had. So I went on to become a gynecologist, and I went to Cedars-Sinai Medical Center, and then when an opportunity became open at Albert Einstein College of Medicine as a fellow in oncological surgery, that is someone who does surgery for cancer in women, I took that fellowship and became the fellow at Albert Einstein College of Medicine in oncology. While I was there, I was asked by the Department of Surgery if I would like to join their department as well and learn to become a surgeon for the breast, because I had given several lectures on the fact that it made no sense to be a gynecologist taking care of women and not know anything about the breast. I became the first resident at Albert Einstein College in obstetrics and gynecology to be trained in breast surgery as well. I then returned to Los Angeles and back to Cedars-Sinai Medical Center, where I was the only gynecologist who had breast surgery as well as gynecological surgery privileges. I've always been a student of science and of medicine and history. I then continued to study and have multiple MD degrees in other areas of medicine and multiple graduate studies. Those graduate studies that are important include philosophy, in which I became the nation's first bioethics surgeon. I wrote law, and that law is informed consent law for hysterectomy for the states of New York, Texas, and California. My speaking out and skills ended up in me being attacked for basically trying to educate women on the truth of science and medicine and how it affected their health and their bodies. Therefore, my testimony that I'm giving today is not the testimony of an emotional female. It is the testimony of a studied student and historian. In my practice of medicine, I saw the many abuses and crimes, yes, I say the word crimes, taking place, and I elected to put 1/3 of my income into creating an institution that would help these issues because no one was fighting for them. I began the Institute for Reproductive Health. I was looking at all the issues that were affecting the reproductive organs of women, from the breast to the clitoris to the uterus, to fallopian tube, etc. And I spent my time and money supporting these issues. In 1995, I asked for a hearing at the FDA in Maryland. And I'm going to go through that hearing in 3 sections so that the listener and audience can have areas to think about, because I was doing a very complex hearing at the FDA Device Committee hearing. First area is morcellation. Second area will be Ovabloc, Essure, and Tubal Sterilization. And the third area was on breast implants, breast surgery, and breast cancer in women. A generalized area was that of the general health of women and the relationship with female hormones. I spoke about the relationship of female hormones in each section that I presented. I was not knowledgeable and not politically astute at that time. I was a young physician on television and supported by Oprah and many others, and I had not been attacked fully at that time. I was under hearings to take my medical license, but I was not really educated in the politics of financial aspects of medicine and the organizations that controlled them, which included organizations such as the American College of Obstetrics and Gynecology, known as the ACOG, the American Medical Association, and even the FDA. Most controlling aspect was the California Medical Board and state medical boards and how they interacted with the institutes of power, which are the medical boards in specific areas such as American College of OBGYN. That is a whole other declaration that I will be making, but I want to make it very clear, in 1995, I did not know how these institutions work together to stop exposure of abuses and crimes. Today, having been attacked for more than 20 years, I am well aware of how the system works. Morcellation. I was a member of the American Society for Gynecological Laparoscopists.